No, I'm talking about Kakamega. I'm talking about Kakamega.
Tuesday morning, and the Senate Health Committee gathered to seek answers from the Health Cabinet Secretary over the 43 billion shilling medical equipment leasing contract with county governments. The probe prompted by complaints by governors that the national government was deducting counties 200 million shillings annually towards the project, which they say was not beneficial in improving healthcare services at county hospitals.
We queried the choice of that particular hospital, why the ministry decided to, in collaboration with the county government, decided to put those equipment there, and the objectives was that these equipment are to serve the people of Kenya. And now those equipment are lying in Baragoi District Hospital for 1 year or 2 months without use.
In a summary way is to say, as of this month, equipments under use and operational are in the range of 97% of all the health facilities.
Reasons for equipment not being used. When you can clearly see that one of the main reasons is lack of specialized staff. And we know very well as Kenyans that many of our graduates are just sitting at home and not doing anything, and they are dying because of lack of employment. Can the ministry really justify that these equipment are not used because we do not have a qualified Kenyans who can use this equipment?
The information provided by the Health Ministry, however, did not appear to appease the senators who demanded specifics of the contract, including the cost borne by each county and the specific medical equipment that had been delivered, as well as if the staff had been trained to use the equipment. According to the Ministry of Health, the leased medical equipment have been installed in at least 98 hospitals across all the 47 counties.
Contract amount of 6 billion shillings, and then the legal costs plus monitoring, the amounts are so massive that the questions which are being brought about why equipment, the reasons why the equipment are not installed, or if they're installed, why they're not working, I think we should have had better answers with this kind of money for purpose of monitoring. But my main issue is this. You know, it is better if you bring us full information instead of bringing it by installment.
Isn't it an act of gross negligence for the ministry and the national government to supply equipment to units they know have no personnel, have no water, have no electricity? And what is the equipment for?
The agreements that were signed by the 47 counties with the ministry, with very specific obligation for the counties. For example, the provision of water, electricity, training to ensure optimal utilization of equipment is an obligation that the counties signed themselves onto. Then one would have expected, you know, you're procuring this equipment in a lot. It would then not be conceivable that you are saying, because this county doesn't have water at that point, withhold, and then you cannot be paid, because the obligation.
The contracts between the Health Ministry and various providers of the equipment incorporate maintenance and training of personnel using the medical equipment. During the first year of implementation of the program, each county was charged 95 million shillings, but this year, the devolved units were charged 200 million shillings from the conditional grant kitty. The senators now want counties that are yet to receive medical equipment reimbursed monies that have been deducted. Kevin Washira, Channel 1 News.